lovelies. I hope everyone out there is doing okay. My name is Jenny and welcome to my channel. Excuse how I look, just lipstick, which, you know, a girl can't go without her lipstick even when the rest of her is not done. And the reason why is because it hurts to sit in this chair. I've worn makeup maybe 5 times this year so far, and it's because I can't sit for a long period of time. When I go to the doctor, I put it on, and I went to the doctor this past Tuesday. I don't know when you're going to see this, but I went Tuesday, February 8th. It took me like 4.5, 5 hours to get ready because I had to keep getting up and then sitting back down and then get up and sitting back down. And the reason is because I have major back problems. If you've been here before, then you would know I have talked about this in the past, and this video is to update you. And oh, by the way, you know, one thing about I wear makeup, my skin cleared up. Yeah, I got little spots. If you've seen me before, you talk about my skin, but you know, and anyway, that's nothing to do with it. So I went back to the doctor. Get it? I went back to the doctor. I think it's been like last winter. I was having major problems with my back. I've been going to a doctor since like 99. I started having back problems like 98. And I did go to a chiropractor that did not like her at all. She told me, oh, okay, you have problems with your back because you were in the army and you stood straight like this and it put pressure. Anyway, she just gave me a bunch of, she might have been right, not saying she wasn't right, but she told me I had to sign a contract that I was going to be there 3 days a week and I was going to do this, this, and that. And I'm like, and she didn't take insurance. It was very expensive. And I told her I can't do that. She goes, well, then I can't help you. So I stopped going. And she was really mean, like really, really mean, because the day after I had my first treatment, the next day, I couldn't get out of bed. I couldn't walk. I was crawling. My mother called her. She goes, well, she didn't do what she was supposed to. You got to bring her in right now. And she told me that day, she's like, you need to do this. And you need to, and she was really mean. I'm like, I told my mom, I cannot go back there again. So I didn't go back. So skip forward when I met my husband, and he's like, I have a chiropractor I go to, and he literally helped me walk again when I was a teenager, and you need to go see him. So I waited for a while, and then I started seeing him, and he has been a lifesaver for my back. And I went and saw him like, you know, like on a weekly basis for a long, long time. And then I didn't go because I got pregnant with my son, so I didn't go for a long time. And then I started going again for my migraines, and he would help a little bit, you know, dull the pain. And then I started cleaning house. I had a house cleaning business for 20 some years, and he told me it was the way I vacuumed. My left side would go out a lot, like the hip would be displaced and it would go out. And he told me that pushing a vacuum like this would throw that side out. So it just kept getting worse and kept getting worse. And I would have to go in for acupuncture, and I would lay on this table that would stretch my back out, and then I would lay on these roller tables, you know, that would roll the spine. And he'd put it back in, and he told me, you know, that I'd have to come in a lot. He wouldn't say, you have to come in. He would say, how about Friday? Can you come in Friday? And I would say, yeah, I can come in Friday. And then he would say, can you come back Monday? And I'd be like, yeah, I can probably come back Monday. And if not, how about Wednesday? You know what I mean? He was really working with me. He worked for a football team years before and worked on them. I felt very confident with him, very comfortable with him. And then over the years, it progressively got worse, but I never had any scans or anything like that done. The first doctor did a scan, and she said I had a touch of scoliosis, and not scoliosis, what's that called that you're born with? What's that word? When you're missing part of your spine. I can't think of what it's called, but I had that in my lower back. She said it's like where the spine doesn't fuse together, but that was never proven. She did an x-ray, and she saw it and said I had it right in my lower back. But I didn't have any scans after that. So fast, way forward after him having this on me, having to, you know, do everything he could to get it back in place. And he told me he'd just get it back in place, you know, to try to make me more comfortable. But it was gonna be an ongoing thing with me. So, but he never did scans. He didn't have that in his office. He has like a really small little country office, you know what I mean? So when I had cancer, I never had any scans done because my cancer was in my breast, so I never had anything done for anywhere else. Then in 2017, I think it was, my brain is not functioning for the last 2 weeks, and I don't know why. It could be epilepsy related, which I'll get to that too. And they did a scan I had some pain in my chest, so they did a chest CT, and then I had some nodules there, which, you know, were okay, but it wasn't alarming. And then in 2019, they did another scan of my chest, and the nodules had grown, and I started having some pain in my stomach. So I went to my oncologist, and I told him that my pulmonary care doctor said that it was no big deal, but it bothered me because the nodules had gotten bigger, and my husband went to that appointment, and he was kind of ticked off because the doctor didn't seem very concerned. So I went to the oncologist, and the oncologist, nurse practitioner, which I love him, said there was some concern, so he was ordering a chest and abdomen CT, and when he did that, they saw nothing wrong there except the nodules had gotten a little bigger, but they saw diverticulosis and back problems. The back issue was that I had some bulging discs and nerve root damage and degenerative disc disorder. And it said just do a follow-up CT. So in 2021 is when I start having this major back problems. Major. And I've said it before in here, probably in another video. I had to get up and woke up one morning and my back was just horrible. Like, it hurt worse than labor, let me tell you. I mean, that's how bad it was, because labor, when I had my second son, the epidural didn't take on the left side of my body, and it just did not work, and it hurt so bad, and that's what it felt like. It was so bad. I had to crawl. Like, I was on my hands and knees crawling, screaming out in pain, and that was like on a Thursday or Friday, and my husband's like, you need to go to the chiropractor. I'm like, yeah, I know, but I didn't really want to go in the office because it is a small office, and with the virus going on, I was panicking to go anywhere. My social anxiety was worse. They kind of diagnosed me with a little bit, just a little bit of agoraphobia. And I'm sorry, I got cat hair on my face, sticking to my lotion. They told me, you know, you got to watch with your white counts being extremely low. They were 2.2 at that point, and they went up to a 2.7, and they just kind of bouncing around. So I was terrified to leave the house. And then by Monday, it was really bad, and I had my online telemed appointment with my neurologist, and you know, I had to do where I got up and walked, and he saw me try to walk, and he goes, you're in pain. And I'm like, yeah. I told him how I was crawling around on the weekend, and it was like forcing me to try to walk, and he said, I want to give you some steroids. If they don't help, then you need to come in and we'll have to do like a nerve mapping and stuff, because he didn't see like the CTs. I was telling them about it, but they were through the oncologist, and I told him, you know, what it was, and he goes, I'm going to give you a steroid and we're going to go from there. But my far as my epilepsy was concerned, he said that it didn't show anything on my EEGs, but sometimes the type of epilepsy, temporal lobe epilepsy, does not show on those. But I had like all the classic signs, so they did definitely diagnose me with that a few months ago, and he confirmed that because the nurse practitioner diagnosed me, as well as my psychiatrist had diagnosed me and sent me there for that. So he said, you know, he confirmed no driving, and then the nurse called back the next day and confirmed it again that no way, shape, or form you should be driving. So anyway, he told me if the steroids didn't work, you know, the steroids did not work. Didn't touch the pain at all, like not at all. And then I went to the chiropractor the next day, and he told me, he looked at the CT, I showed him the CT, and he said the degeneration is so bad. I was like a level 3 out of 4. I can't help you, but I can get it back in place enough for you to be able to at least walk and kind of get the pain away temporarily, but I can't really do anything. The bulging disc may heal itself like they do, but other than that, I really can't do anything. So he fixed me, and then I had to go and walk around with this, it's called a TENS machine, like where they send electric shocks through it. You know, I had to walk around the office with that for a while. An hour later, because I was there for an hour, the back slipped out again before I left the office. As soon as I stood up, walked around, sat back down, stood up, it went out again. So he readjusted me and said, yeah, you're going to have some problems. Do these exercises at home. Oh my God, the cat hair's driving me crazy. He said, do these exercises at home and then come back again in a couple days. Oh, back again in a couple days. And it was still out on the left side, but it was more located like in the hip area instead of up and down the back and up and down the legs. And he told me, he's like, you're going to have some problems. We'll check on you again. Well, a couple days it got a little better. You know, it wasn't as bad. And then it was, I guess, the middle of the year in 2021, start having pain again. And then the pain kind of radiated down around my stomach. So my oncologist, nurse practitioner again, said we need to order a follow-up. Just do a full scan from your chest all the way down to your abdomen, because the last one you know, we were seeing the lung nodules. We needed to check them again. So the CT came back, and luckily the nodules were stable, which I was like, whew, so thankful for that. But the CT scan that time showed I had a disc herniation, and everything else on my back had gotten worse. And it suggested I do an MRI. I think that might be my husband. Let me check. No. It suggested dogs. There's nobody there. Babies. There's nobody there. This happens every time I get on here, doesn't it? It suggested I do an MRI, and it said that it was also related to my neurological issues. So I went to, when I had my, you know, recheck with my oncologist, because then I went to the actual oncologist, and he told me, luckily, that didn't show anything cancerous. So he was done with his part. And he also told me my white cells just kept dropping, and he was done as far as any scans anymore, which kind of was like, he's like, no more scans, no more lab work, because your counts always drop. We don't know why. So I'm done with all that. I'll just see you every 6 months for just a regular checkup to check on you. I was like, okay, you know. So he said, just either go to pain management or something for your back, because it is pretty bad. And I said, well, I have an appointment Monday with my neurologist. I'm going to have them handle it, since, you know, I'm having these neurological episodes as well. So when I went back to the neurologist Monday, it was with a different nurse practitioner. Mine had left, brokenhearted. Mine had left, and I had a new one. And I think I may have told you about her, but I don't remember. So I'm just going to give you a backstory for someone that has not been here before. This woman was horrific. She said, I am new. I'm looking at your charts. Just give me a minute. Don't know why she didn't review my chart before I had my telemed visit. Shouldn't she have checked that before she got on there? So I waited for a while before she even got on there. And she was like, well, I worked with a very prominent neurologist, and I'm you know, this neurologist was like a very good one, and I worked with the neurological epilepsy team, and I can tell you, you don't have epilepsy. So, you know, because my psychiatrist told me that I had ADHD, which thank God they finally diagnosed me with that. And they needed to see what medicines I could be on, so to ask them before they put me on one, because some of them do have a tendency to react with epilepsy. And she's like, well, it really doesn't matter then, does it? Because you don't have it. And I said, really? I said, because your boss, your doctor, diagnosed me with it. She goes, well, he didn't really know because he's not a specialist. I'm like, he's a neurologist. He's the head of the whole department you work with, you know? And she's like, yeah, I don't think you do. You know, we can order another EEG, but I really don't think you have it. And I said, well, have you looked at my CT scan? Because it says I need an MRI. She goes, no, I'll look at it later, and if I think you do, you do. And I'm like, no, you are going to order me one, because I'm having major back pain. Like right now, as I sit here, I'm having major back pain, and I need it done. This was in, because by the time I got my results back, I think it was the 1st of November. And she's like, well, okay, whatever, we can order you one. I'm like, geez. And she said, and we'll send you for another EEG to prove I'm right, because I'm right. It's like, who the hell is this woman, you know? And the whole entire time, she's very condescending. Everything I'm telling her, she's very, very condescending. And I did not like her one bit at all. Hands down, not at all. So after I had my appointment with her, she had scheduled my EEG, but it was at the hospital instead of her office where I had my last two. So it was like she was taking me out of her office. She sent me to the hospital. She's also sent me for an MRI, and then I met with her after I had the MRI and after I had my EEG. I asked them when I had my EEG. I told them what I didn't like about her, and they said, because I told them I didn't really want to say anything. She was, oh, honey, you can tell me anything, because I'm not affiliated with them at all. And I explained everything to her, and she said, yeah, we don't usually see temporal lobe epilepsy on our EEG, so we're not really sure why she sent you here, but we'll go ahead and do one anyway. And of course, it came back normal, just like I thought. But this time, I had a list of percentages that this stuff comes in, because she said, you just need to go back to your psychiatrist because you're having psychotic episodes. I'm like, the psychiatrist sent me here in the first place, you know? So I was like, ooh, because they sent me to them through my normal doctor. First for the migraines, which they finally found something for, and then also this episodes that I was having. And in my research, I found out that people with temporal lobe epilepsy also had different psychological things like bipolar disorder, like anxiety, depression, things like that. It's like it goes toward that. And she told me it was the other way around, that I had psychotic episodes and not epilepsy. So I was like, So I had all this stuff, like a piece of paper, and I had like all these things because I have the deja vu. I have the, all of a sudden I'll have anger or anxiety. I have the forgetting where I am, forgetting what I'm doing, losing track of time, get stuck mid-sentence. I have the aura of smells that I usually don't have. I have all of those things, plus the different mental disorders that I have. That's all tied in to epilepsy. So when she started to say something, I'm like, yeah, but do you know 7% of people, or do you know, and I'm like naming this off, and she's going, okay, well, do you want to just go to someone? I'm like, yeah, I want a specialist. I want someone that's going to like go through all this with me and tell me. I want someone other than you that's going to tell me this. And she's like, okay, well, I'll send you to an epileptologist. I can't remember the word. And I'll just have him work with you. And I'm like, okay, let's go over the MRI. The MRI showed, I've written it all down. MRI showed I had 2 disc herniations, disc desiccation, which means loss of fluid, degenerative disc disease, which was worse before. I had 2 benign tumors on my spine. I have nerve root damage, and then later, by the time I went to my neurosurgeon, which is someone else that got sent to because of my back, I'll get to that in a second. Also have arthritis. I have liver cysts, and then I have a lumbar disease, and I have stenosis and sciatica due to the pressing on from the herniation. So she was like, "You just want to come in here and get some shots?" Just like blown it off. And I said, no, I want to see a specialist. She said, well, I'll send you to a neurosurgeon. I'm like, fine, that's what I want. She's like, okay. And then she was like, okay, well, just we'll follow up with you next month. I'm like, okay. Like it was nothing. And I'm like, yeah, I really don't want to see her anymore, but that's who I need to see, you know, because he only, my neurologist only sees me like once or twice a year. So I'm like, oh my God. So I had my appointment with my psychiatrist, and she said, that is so unprofessional. You need to call your doctor and say, look, I just don't particularly want to see her again. I'd rather see you because I want you to explain things to me better than she does, if that's okay. Just don't tell like her, I don't want to see you anymore. Just talk to him and see how you feel. And if not, find another neurologist. She said, I know they're really hard to get into, but maybe you just need to find another one. I'm like, yeah, I kind of think that's what I want to do. So anyway, I'm still waiting on this neurological doctor to call me because he hasn't called me yet. So I went to my neurosurgeon this week, and he told me that, number one, I have some major back problems. He said the main concern with him is this second herniated disc in the L5S1. He told me that it's huge. I'm using italics. I'm telling you exactly his words. He said, you have a huge herniation that's pressing on your nerve endings. I'm not concerned with the other ones. It's causing stenosis. It's causing your sciatica nerve, because right now, in the last 2 months, I've had the worst pain in my back. I can barely walk. It puts pressure all the way down into my thighs. Sitting here, when I get up from now, it's gonna hurt really bad. I'm gonna be crying, put it that way. I can't sit in this chair very long, maybe 25-30 minutes, and then I have to get up because it hurts so bad. If I stand very long, like when I'm washing my face or my skincare, I have to like stop. I have to stand with my leg back a certain way, and I have to move it a certain way. If I bend down, if I twist, if I turn, I reach, it hurts. Like girls, boys, anything in between. I say that in a good way. Don't think I'm saying it in the wrong way. Guys, it hurts. It really, really hurts. So by him saying that, it gave me some, validation of my pain being a reason for my pain. He was amazing. The nurse was amazing. The nurse practitioner, they were very thorough. They did a complete exam, checking my feet, checking my legs, checking my buttocks, checking my back. Every single thing that I haven't had done before. The first nurse practitioner did all that, but not like this. They checked everything. They had me walk. They had me sit. They had me lift my feet. They had me do pressure, which on my left leg I couldn't do. She wanted me to lift my foot up, and I couldn't do it, so she lifted it up for me and then tried to put pressure, which I couldn't do. They had me do stuff with my hands, checking for reflexes on it. They checked everything, and it felt so good to finally have that. And then I was talking to him, and that's when they found the arthritis in my back. He said the scan didn't show it to them, the radiologist, but he sees, as a surgeon, he can see stuff they don't. And he says that the tumors are actually growing out of the spine, but not into the spine, which leads him to think that it's benign. But he said, but we do need to keep an eye on them. He said, if the pain travels up my spine where it's located, then we have a problem because of my history of cancer. So he said if it ever causes any pain from like here up to definitely to definitely let him know that. So he was concerned about that where no one else has been. So that's a good thing. And he said, I need surgery. He said that he thinks that since nothing else has worked, like steroids haven't worked, over-the-counter pain pills, because I'm allergic to narcotics, hasn't worked, heat hasn't worked, exercise hasn't worked, none of that's worked. He says he thinks if I was to go through physical therapy and have an epidural shot, he says he doesn't think that'll work for me. He said it might work for, 4 or 6 weeks to get rid of the pain, but it's just going to keep coming back and possibly come back worse. He says that he doesn't think I'm a really good candidate for that, but he thinks I am for surgery. The surgery he's going to do, he's going to removing the vertebral bone that's there compressing against the spine into the nerve, which will release the herniation. He said he may have to take the whole bone out or a partial part of the bone. He won't know until he gets in there, but it's going to be very minimally invasive. The cut is only going to be about that big, maybe 6 inches, however big 6 inches is. And then he'll go in with like a, I forgot what they're called, this tube thing, and then he'll put another tube to slowly increase as he goes down, to increase that space. And then they'll go in and they'll move out of the way. They'll move that nerve out of the way slowly to find the herniation, and then they'll move the rest of the nerve out of the way. They'll go in and they'll take that bone out, and they'll check the bones around it. If the herniation is worse, then they'll have to take the whole entire bone out, and then the herniation will be back to there. The disc will be back to where it belongs, and then the nerves will just reseal, and then they'll seal it up, and then I'll be done. And it sometimes will last like 10 years, and then if the herniation goes back out, if the second herniation gets worse, then we'll have to revisit it. But he says after the surgery, I'll be able to walk again. I'll be able to be pain-free. It'll be like a 6-week recovery, and that is what I'm worried about. I'm not worried about the surgery. I'm worried about the recovery, because I won't be able to lift anything higher than here or anything below my hip. I won't be able to do. So I'm worried about my animals. If you guys have been here before, you know I have a lot of reptiles and things like that, and I won't be able to. A lot of mine are up like here, so I won't be able to do that. But my son Jake told me he was going to help me with that. He'll like bring them down for me to clean. Mice, I'm not going to be able to, because they're really, really heavy. The tanks, 20-gallon tanks, I'm not going to be able to lift them up and then be able to, I think I'm running out of time on my camera, I'm not going to be able to lift them up, so we're trying to figure out a way to get them up so I can clean them. I'm worried about my cabinets because I can't reach them, so I happen to get up and get cabinets. They said to like bring things down that you're going to use, so I can just get them to do it. My husband and my son, like, hey, I need this up here, can you pull it down? Maybe get on a step stool. I'm not sure that's going to work yet. After surgery, they're going to go through things with me of what I can and can't do. I do have an appointment coming up. My surgery's on March 16th, so if you guys can send some good vibes, manifest for me, pray for me, whatever you believe, please send that my way. My appointment is on March 8th because my insurance requires that, and I'm still waiting for a final approval of my insurance. I'm hoping that they don't make me try to do that 4-week plan ahead of time, because I don't want the needle. I'm terrified of that. But I'm hoping that they just go through with the surgery, because he said that I'm not a candidate for anything else. I've tried everything for the past year, and the fact that I've been in pain that entire time, that should put me right into the surgical candidate. When I had my meeting with the team that goes over all your paperwork, and it's like that thick of paperwork, she told me the insurance requires this beforehand, and I've done everything. I have to go for my COVID test on the 14th, and have labs before that for my EKG to make sure my heart is strong enough. I'm going to turn this off, turn it back on, and I'm back. So I had to do all that ahead of time, so I'm just nervous about getting everything done in time. So yeah, there's a lot of nervous tension going there. They even put on my record that I had anxiety, because I was like, what about this, what about that? So then I asked him, okay, I'm waiting to hear from Dr. Henry, because he's Dr. Selznick. Dr. Henry is the one that is the neurologist that I'm supposed to, neuroleptologist, I can't even, epileptologist, that's it. I'm waiting to hear from him that I haven't heard from. I said, did they just send those records to you to maybe talk about that, because I know you deal with epilepsy as well? And he said, no, I'm the epilepsy, whatever the word is, surgeon, and they run a clinic out of there. They run an actual Virginia, which is, I live in West Virginia. I do all my doctor care in Virginia, which is where I came from. I don't do anything at all in West Virginia, like nothing. He said that they actually run a major clinic. It's a surgical clinic as well as what's it called, a diagnostic clinic for epilepsy. And that's where my nurse practitioner my neurologist used to be with, she's no longer there, even though her name's still in there. I don't really understand that. Like, maybe she's still a consultant. I'm not even sure. But she told me she left them, and I don't know what that's all about. But anyway, she's still listed on their website, so I don't know. But anyway, I didn't know that, and then I was telling him how much I don't like her. But anyway, he told me, like, they have this huge clinic, and he and Dr. Henry and another doctor are the ones that run it. So I asked him about it, and I said, I'm still waiting to hear from him, but according to the doctor that sent me here, I said, Rachel says that I do not have epilepsy. The EEGs don't show it. And he said, you absolutely have epilepsy. He said, I looked at your chart, looked at your scans. He said, the thing is, the aura epilepsy, the kind that, the things that you smell, the things that you experience, are not going to be detectable on an EEG, and it was a waste of time for you to have those done. It's like, yeah, I thought so. I said, the thing is, I'm like, I have all the classic symptoms. And he goes, yes, you do. He said, you 100% have epilepsy, and for them to tell you that is wrong. He said, just get on them and tell them, get your appointment with Dr. Henry, and get everything done with him, and if you do need surgery, which I don't think we're going to need surgery, I don't think it's that complex. He said, then you come to me. Even though Dr. Henry does surgeries, since you're my patient, it'll come to me, and then I'll take care of that. But honestly, I don't think that ever is going to come to that. But he was telling me that. He said, you need to get in to see Dr. Henry. Now my concern is Dr. Henry going, since she worked for him, is he going to agree with her, or is he going to agree with Dr. Selznick? I'm not sure about that. But he literally looked me in the face and he goes, you absolutely have epilepsy. No doubt about it. So that gave me such validation, guys, because, even though the other doctors at my neurology, the nurse practitioner, the doctor told me I had it, even though the EEG didn't show it, they told me it's not going to show it. The fact that the new nurse practitioner told me, oh, you epilepsy, you don't have epilepsy, and all that, it made me feel so validated. And I have my appointment with my psychiatrist this coming week. So I'm going to tell that to her. The sad thing is she's not going to be there anymore. She's having a baby in April. So my appointment with her is, unless she has another one lined up, I don't think I'm going to see her again. I'm going to ask her if I can see her after the surgery. But I don't know if she's going to be there in March. I'm not sure, but I'm going to ask her if I can just see her one more time, because she has helped me so much. She helped me with my eating disorder. She helped me with a lot of things, like as far as the depression. I was bad. I was so much in depression when my nephew died, and she has helped me through that to where the other doctor in her practice did not. I'm supposed to go back to him until he retires in August, and I really don't want to, because even though he helped me a lot for the past, 15 years, he doesn't listen to me the way she does. We have a connection because she also had breast cancer, the same type of breast cancer I did. So we have that connection, and I don't know whether or not he's going to agree with some of the things that she said, because he wanted to send me away to an eating disorder clinic, and she's like, no, your anxiety just will not let you do that. So she was like, she's been so amazing, guys, and now I have to find another one like her, and I don't know if I'm going to be able to. So I have that anxiety too. So anyway, I just wanted to kind of update you guys and let you know where things are right now with my health, with my back. At least right now I don't have, the migraines. The only thing that really concerns me about surgery, if there's anything that concerns me, are the risks. He told me it's not likely to happen, but it can. I was going to ask him if it's ever happened to him, but I'm scared to ask that. I've done research through the internet and also through people I know that works with him, and they told me he is so good. So that gave me a really good feeling in my heart. He told me the risks are that he could damage the disc worse. He could damage the nerve root even more than when it's already damaged. He could take out part of the actual nerve completely, which would leave me paralyzed. He could nick the spinal, what's it called? I can't remember what it's called. My brain stopped again. I don't know what it is. I can't remember. But he could nick something and it would send spinal fluid into my brain, causing severe headaches, permanent severe headaches. And I can't do that. So that really concerns me. He said also it could not work. There's 90% chance it will. But if you've heard me before talk about the negative things that's happened, I could fall in that 10%. I fell in that percentage with my chemo. I was allergic to things that very, like 3% of people were. But also, I also had, when I had my surgery for my mastectomy and lymph nodes, the chemo helped and I didn't have any left. Even though I haven't hit that 5-year mark of cancer-free, it still happened with me. So I fall in that good percentage as well. So I'm just hoping that I'll fall in at 90%. But like I said, it doesn't last forever, so I'll probably have to have it redone in the future. But if that just gets rid of this pain, guys, I'll be so excited and so happy. Anyway, I hope I can sit down here and get through some of these other videos, because I have other boxes and things to do, but I didn't upload December's because it's too late and I just didn't do it. I have been doing some decluttering videos that I've been putting up, and that people seem to like that more than just unboxings. But I'm still getting my ice cream. I'm still getting Ipsy, but I got the Face Tory. I got one, and then they sent me another one because one got lost in the mail, but I have that on pause. So, you know, I still get those, but other than that, I'm not getting any more. Oh, I do have one though. It's a special one. It's a one-time thing, but I'm not going to tell you. I'm just going to tease you. It's really, really good. And I want to do that one so bad because I'm going to use the things that are in it, but I'm kind of waiting to do it. But I really, really, really want to do it for you. So I hope that I can sit here longer. But right now, I need to get up. It's hurting. Yeah, it's really hurting. I got to get up. But I love you guys so much. Thank you, thank you, thank you for being here with me. Thank you for all the thoughts and concern that you guys always send to me. And I hope that you come back and see me again, and maybe I'll look a little more presentable with something other than just lipstick on. Oh, I do have my eyebrows on, but those are just stickies. I can put them on in the bathroom in 3 minutes, so at least you get to see me with my eyebrows on. But anyway, guys, I love you so much. Thank you for joining me here today. If you like what you see and maybe want to see more, you can go back and look at some good videos. But if you like what you see, don't forget to like and subscribe. And come back and see me again. Check me on Instagram because I'm trying to post a lot on there that you don't see here. So go check me out over there, and I'll see you again hopefully soon, and maybe some different types of videos. Bye, guys.